How reopen the country and protect the nation's public health? That is the question before lawmakers and public health officials as they weigh when and how to ease social distancing guidelines in the U.S. Joining me now on Skype to talk more about this is Dr. Mark Strand, professor in the North Dakota State University School of Pharmacy and Department of Public Health. Mark, welcome to the show.
Thank you.
So what do we know so far about the impact social distancing has had on curbing the spread of COVID-19 here in the U.S.?
It's been absolutely essential in being able to suppress the outbreak. You know, when we think about New York City, for example, which was hit so hard, the state put in shelter-in-place orders on March 20th, and within 15 days, they were able to see the curve peak out and start to decline. And so there's no question that this isn't the result of having implemented social distancing practices and seeing the American people rise up and respond and respect that.
Well, federal and state lawmakers are looking at ways to possibly lift the stay-at-home orders and also to reopen the country. How difficult is it to predict when to do so? And do you think that we can do it and not lose the ground that we've already gained?
It's extremely important that we do this on a regional basis. I think the White House has provided some good guidance with the Opening Up America document, which talks about phase one requiring 14 days of having sustained a decline in new cases and a decline in the number and the proportion of cases that test positive. And so that 14-day window is particularly important. And I think that can allow regions, and we've seen states come together in coalitions to work together to protect regions because there is that variability. So I think that should give us confidence that we can start to open up, but we need to do that in a way that's alongside the evidence, not by, just rash decisions.
Mark, let's talk about testing. How important is it and what type of testing is needed?
Testing is absolutely critical. Currently, we're just testing for RNA, and meaning testing that a person has disease presently, but we need antibody testing to determine who has been sick or who is sick but hasn't yet developed symptoms. And so testing allows us to, one, determine the extent of the outbreak in a given community or how many people really have the disease. But beyond that, it's also really critical to be able to confirm that, say, healthcare workers, teachers, or other individuals who have a lot of essential roles and in contact with lots of people, that they're not sick and therefore can confidently go back to work. And those whom they're serving can be comfortable that they're not going to contract COVID from somebody who's, attending to them. So the testing is extremely important. And we're seeing states who are doing high rates of testing. They're also seeing lower rates of test positive. So that's demonstrating the ability to get a handle on the extent of the problem and thereby snuff out small clusters that do appear in different cases.
Mark, quickly, we don't have much time left, but I want to ask you about contact tracing. There's a lot of questions swirling around that. Can you explain what it is?
Yeah, it's when a public health professional finds all the individuals that a sick person has been in contact with in the previous 14 days and then just determines that they aren't themselves sick and therefore able to quarantine them in order to suppress that outbreak. So it's just basically tracking down individuals that a sick person has been in contact with. Again, really important. We need lots of resources to help with that over the next few weeks and months.
Well, Mark, thank you so much for joining us, for your analysis and helping us to sort this all out. Dr. Mark Strand, thanks again.
My pleasure.